Good morning. So today I'm going to talk about the impact of the pandemic and the social distancing, remote learning. What kind of effect does that have on our not only mental health but physical health? Because after nearly 3 years of suffering from the aftermath of the pandemic, I think we're all come to realize, we're really not the same, and many of us are not okay after this unprecedented changing our social structure and our ability to connect with other people and loved ones have drastically been changed. So, as a frontline pediatrician, I am witnessing the effect of these things. I will focus on mostly on the physical devastation that the pandemic has on our health because the mental health is fairly well recognized and well studied. Obviously, people felt isolated, people are anxious because of the constant changing infection and the epidemiology of the spread of the virus. But also, obviously the depression and anxiety that comes along with it. The physical aspect is oftentimes neglected. I am seeing, however, many of my patients, due to the combination of inactivity, the loss of structure in their social networking, the absence of opportunity to participate in team sports where they were connected before, that all comes with a toll. And finally, after so many years of the pandemic restrictions, frequently the only source of joy that you have left in our daily lives is basically eating. And a lot of people end up at home eating, have ready access to food and snacks all day. So they're eating a lot more than usual. And compounded by their underlying anxiety or depression, many people end up eating a lot more than usual too. So the end result is that I'm seeing kids as young as age 4 or 5 gaining massive amount of weight. I'm talking about 30 to 50 pounds, and the impact on older children, including adolescents, is that it's affecting them even more because at that age they're more reliant on their social well-being to be with their friends, and without that, and uh, due to the lack of physical activities and options, some of them gain more than 100 pounds, and we're all seeing the consequences of that weight gain. We're seeing a tidal wave of patients who are newly diagnosed with diabetes, sadly, and we're seeing a lot of associated problems with obesity, including joint problems, arthritis, back pain, and yeah, even asthma exacerbation. Of course, ironically, you know that one of the risk factors for COVID 19 complications is obesity. So it's kind of like a chicken or egg scenario where the act or the measures that's designed to prevent people from catching COVID 19 is actually predisposing them to have complication from COVID 19 if they end up eventually catching the disease. So at this time, as we emerge from the pandemic and the community spread is reducing, we are seeing more and more people suffering from other viruses. But this is important because we need to finally emerge from the quarantine measures and go back to our physical activities and go out with your friends and go exercise with your friends even better. So take care of your health. Certainly don't neglect your mental health, but your physical health is just as important because they're interlinked. All right, and with that note, take care. Bye bye.